Have you ever wondered what happens when we surgically remove a tumor or section of cancer? What if we leave behind a big empty space? Do we just leave it hollow? Oftentimes, the patient has the option for reconstructive surgery, otherwise known as a free flap. To put this in layman's terms, when we remove a large section of soft tissue, bone, or both, we replace it with another part of your body. Amazing, right? Let's use breast cancer as an example. When a patient gets their breast tissue surgically removed, it's called a mastectomy. They have, for the most part, three options afterwards. They can go without anything to replace the breast tissue and leave the chest flat. They can get breast implants, or they can get a free flap reconstruction. There are many different flap options, but I will use one of the most common types for the sake of this video. Patients have the option to essentially take their stomach fat and other tissue types and use it as breast tissue, so they are replacing the newly hollow area with stomach tissue. This seems awesome and, when put plainly, simple, right? Well, it is easy to make it sound simple, but it is actually very difficult and a very time-intensive procedure. When you think about it, you need blood flow to keep anything in or on your body alive, right? The same principle needs to be applied here. When taking the stomach tissue, the surgeon needs to harvest at least one vein and one artery and keep it attached to that stomach tissue that's going to be transferred up top. They then have to reattach the other ends of those arteries and veins to the new location with a technique called microsurgery. Why do they have to attach a vein and an artery? Well, veins and arteries do two very different things. One brings blood to the flap, and the other brings blood away from the flap. So if you connect the blood supply but don't give the blood any way to exit the flap, you will get what is called congestion, which is a backup of blood, and as we all know, stagnant blood can lead to clotting, which means bad news for any patient. If you don't hook up a way for the blood to get out of the flap will, what we call, die, because it simply doesn't have any blood to supply it with life. There are so many different types of flaps out there, and they are all dependent on where the location of the resection or the removal of tissue is. Another example is if someone has a tumor in their mandible or jawbone. We will resect or cut out the tumor and replace the portion of jawbone with a portion of their fibula. Yes, you heard that right, their fibula. Did you know that your fibula is a non-weight-bearing bone and you can walk completely normal without it? Amazing, right? The surgeon will make little cuts in the bone called osteotomies to make the angles in the jaw and use screws and plates to connect it to the remaining healthy jawbone. When the surgeons connect the veins and arteries, it's called anastomosis. They do this typically in two ways. One way is sewing the artery ends together with a tiny, tiny suture by hand. The second way is by using a coupler implant, typically on the veins. This implant cuts back on the need for hand sewing. I'll put a picture here to show you how it works. To use this coupler implant, the surgeon has to use an instrument called a microvascular coupler. If you look in our other videos, I gave an in-depth explanation of each piece of the coupler set and how it works. While the surgeon is working on these veins and arteries, they can't have blood flowing into their surgical field. It will obscure their view. So they will use little clamps, referred to as bulldogs, to temporarily clamp the vessels so no blood exits them while they're trying to sew them back together. Free flaps are an amazing procedure and can make a monumental impact on someone's life. They are unfortunately not always an option, but when they are, they can help surgical patients to lead more normal lives. As always in our videos, this is in no way medical advice. We always want you to see your own physician and have conversations with them about any medical issue. If you have any questions or comments, let us know.